Stephen Robert Shelton wasn't born rural, but his roots and family have strong connections that have inspired and sustained his interest in rural healthcare. From his grandparents' farm and cattle operations to his sister's family ranch, the personal experiences have guided him to stay true to the course. Do what is right, and be serious about positive outcomes for those in need.
Steve Shelton's rural-focused work began as a family practice PA in a rural coastal rice farming community. That experience was foundational in fostering a career in health workforce development, health literacy, and community health improvement. An influential leader and faculty member of the University of Texas Medical Branch since 1981, Steve has championed educational programs relevant to rural practice. The heart of Steve's work impacting rural health policy, legislation, healthcare, and health programs is his 24-year leadership of Texas AHEC East. He authored the proposal establishing AHEC and worked tirelessly to create and sustain 9 regional operations serving 111 counties, half of Texas. Through AHEC, he developed a full-spectrum infrastructure that has received $60+ million in funding. AHEC has substantially impacted the rural health workforce, linking training programs and local providers, building strong community relationships, establishing professional mentorships, all extremely powerful recruitment and retention tools benefiting rural communities.
I'm grateful that I had the opportunity to be mentored by Steve Shelton during my years at Texas AHEC East. His compassion for the rural and underserved has been an inspiration to me. Steve has been a champion for those who did not have a voice of their own. Through his work as a PA, his leadership at Texas AHEC East, and his personal mission work, Steve has touched an untold number of people.
Steve's personal life also reflects his commitment to serving underserved populations. Just one example of that commitment is his many years of leadership of large groups of youth in the repair of homes for rural elderly residents. That service impacted the homeowners, rural communities, and the lives of the youth he mentored.
Steve was instrumental in the development of the Robert Wood Johnson-funded Southern Rural Access Program in 8 southeastern states during the late 1990s and early 2000s. Subsequent to the Southern Rural Access Program, Steve was also key in the creation and development of the Southern Health Improvement Consortium in the same southeastern states. Steve has served as an inspiration to his colleagues and a mentor to his students. His leadership on national and regional issues is consistent and his commitment to rural health unwavering.
Steve Shelton's care, passion, leadership nationally and locally, and unqualified success at developing and sustaining systems to meet the needs of rural populations truly embodies the spirit of the Lewis Gorin Award for Outstanding Achievement in Rural Healthcare.
Good afternoon. I'm humbled and deeply honored to be the recipient of this award today. As I look across this room, I see many faces of people who have contributed in some way to my career. I hope that I'm able to share just a small bit of wisdom from a lifetime of experience in rural healthcare. I want to thank the people of Texas AHEC East for their vision, for their passion, and for their ability, energy, and enthusiasm to just get things done. I also want to thank my family for putting up with me and having the patience with me when I've had lots of different things going on with my work. And finally, once again, thank you, NRHA, and the people in this room. You are the ones who can make a difference for rural health care. Good afternoon.